questions you have about what it might be like to start something like this.
Do you think this is reproducible?
Yes. Is it reproducible? This is a key question. The answer is yes, but you must have a great research university. On the other hand, having a great research university does not guarantee success. I mean, for instance, I've been to Stockholm several times. They have several great universities. They don't have the culture. You know, there are a number of places that have very good universities that don't have the culture. Beijing, for instance, you don't have that culture. Singapore, you get the culture, but not enough. Where else was I recently? Santiago, Chile. A couple of quite good universities there, but they don't have the culture. So it is reproducible, but it takes effort, and it's particularly important that you have a top university. And it also helps if you can focus on some broader area where there's a synergy. Yes?
Can you speak a little bit about the role of non-dilutive funding grants in starting a company?
Okay, I'll do my best. I'm not sure what I'm not sure I know exactly what non-dilutive funding is. It's basically funding where you get a certain number of shares of the company. Is that what you mean?
No, I'm talking more about the use of grant funds.
Grant funds, yes. Grant funds in companies, I know it happens. I'm not very enthusiastic. I mean, there's the SBIR, the Small Business Program, where companies can get this kind of grant funds. And my experience, although I don't have numbers to back it up, is that not a lot of these companies make it. In other words, it really is the marketplace. That's my sense. I think grant funds are very important at the earlier stage in universities and hospitals where they can support the basic underlying innovative science. I think once you get to a company, as I said, you start the company to make money. The exception would be venture philanthropy in rare diseases. And I'll come to those, but diseases where there might not be a marketplace, that someone often with family related to the disease can support it. That would be an exception, but it could be a common exception. Great questions. Please.
Okay. You mentioned that MIT encouraged the faculty to start companies. This is very different from a lot of other universities in the world.
I know that.
So can you talk a little bit about what led to that decision and what's the rationale behind that? How do you develop that kind of culture to... Yeah.
Well, how to explain it? First of all, in most countries, universities are run totally by the government. And governments, as I said, don't like innovation. They don't know how to support it. And in many countries, if you're working at a university, you're a civil servant. And God forbid you should do anything other than work for the university. So it's a cultural difference. MIT, like Stanford, like others, sees itself more as an engineering institution. But increasingly, other universities in other countries are going to this model because it works. And I'm glad you asked the question. Wherever you come from, make the change. I'm not joking. I'm not joking. I talk to government ministers reasonably frequently, and that's part of the message. And you see, I put it in a slightly different way. That is, if you're at a university and you've conducted research in a certain field and you've made a discovery that you think can lead to a drug or a pharmaceutical or a device or whatnot, I've come to the realization that we have an obligation to society to take that into the marketplace. You see, I sort of turn everything on its head. It's not that you start a company to make money, although you do, but you start a company because you have a unique idea, a unique product, potential product, and I think we have obligations to take it out and do something with it. So I think that can be an argument that is used. But I agree with you, most countries, most universities don't have that. One more question, if there's one. Okay. Yes, lady, yes.
You spoke to the fact that you thought Boston has a unique culture, or you said that it was reproducible, this model, but that many places have good universities and not the culture for it. Can you speak to what are the core elements of the culture you think exists here?
Well, it's a culture of entrepreneurship that is passed on from generation to generation. I mean, and I'll give you two personal examples, okay? And this influenced my own decision. When I was an undergraduate at Kenyon, I spent a summer in an organic chemistry lab at Stanford. Pure organic chemistry. The head of the lab, some of you may know his name, Carl Gerasi. He was an organic chemist who realized that some of the steroid chemistry he was doing could be used to synthesize the molecules that became the oral contraceptive. And he set up Syntex back in the 50s. He became a billionaire, but, you know, I think everyone understands what a huge impact birth control pills had on society. Second example is my brother Leonard, who followed me to Kenyon and then did a PhD here in this building, or the predecessor of this building, the Sloan School, with John Little. And we're talking 1967. He started a company called Management Decision Systems. So this has been going on for a long time, and it's relatively recently that biologists have gotten into the game. But the econ folks, the chemists, they've been doing this for a long time. This is not new. One more.
Thank you. I just want to know, what are the hot areas in biotech where the money is chasing the company, and what do you think is the future in that space?
Well, the money is chasing good ideas. Not every idea is a good one. And I think we'll come to that as we go through the course. Okay?